Our patient today has L2, L3, and L3, L4 disc bulging with compression on the right L3 and L4 nerve roots. So we're going to do a transforaminal epidural injection for the L3 and L4 nerves. So we start with the AP position with shift of the C-arm caudad or cephalad to obtain a straight or flat and superior end plate of the vertebra we're working at. As you see here, it's the superior end plate of L3 vertebra. The next step will be to shift into the ipsilateral oblique position. Here you have to use your imagination to see the Scotty dog image. Our target will be the supraneural area or the infrapedicular point. So our starting point for the needle will be at the 6 o'clock of the pedicle, and we're gonna move our needle until we obtain the target view or trajectory view, or sometimes it's called the bullseye position, as you're gonna see in a moment. This procedure is a multi-plan procedure, so we have to use always to shift between AP, oblique, and lateral views to maximize the safety. So at the moment you are seeing the target or the bullseye view. We start to advance the needle till we feel that the needle is already fixed into the tissues, so it's not moving on itself. At this point, we're gonna go back into the AP position. By the way, we always make a bend in the tip last centimeter of the needle. As you see, it is bent, the needle. This will help us steering the needle around when inside the tissue of the patient. So we do this bend in the opposite direction to the bevel. Okay, we approach a little bit under the pedicle. Then we go back into the lateral position to see if we are approached to the foramen. Our target will be the upper 1/3 of the foramen for this procedure, which is you are targeting the safe zone, okay, or safe triangle. Soon we'll be making another video where we target the infraneural area, which is the Camden's triangle. As long as there is a lot of talk regarding the safe zone, that it's not that safe. Back into the AP, where we see that the needle tip is under the pedicle directly at the 6 o'clock. At this point, we inject the contrast media. I usually use very small amount, maybe 0.5 milliliters to maximum 1 milliliter. As long as if I need to manipulate the needle again, if I don't like the spread of the contrast that already has been injected will not obscure the view. Okay, here you see a good spread along the path of the nerve and into the ipsilateral anterior epidural space. Okay. So at this point we injected the medication, and now we're going to perform the same procedure for the level below, which is the L4 transforaminal infrapedicular or supraneural approach. Here we're going into the oblique position with the bullseye. Once we have advanced a little bit, we're gonna shift back to the AP view. You see that bend in the needle, it is as long as it is opposite to the bevel of the needle. So the mark on the hub of the spinal needle, which I use usually 22 gauge, it will be opposite to the direction of the bend. So we can have an idea in which direction we have to move our needle inside the tissues. Once we approach a little bit the infrapedicular space, we're gonna go into the lateral position, which is the safest position to advance the needle without having any injury. We should never bypass the 6 o'clock point under the pedicle, as long as beyond this line we have risk to puncture the dura, which is the last thing we need to do. Our patients are always awake. We don't usually insert IV lines. They are fine. We just infiltrate the skin with lidocaine 1% or 2% mixture, and that's it. Now, when we are under the pedicle, we inject the contrast, and as you see, the spread along the nerve root and into the epidural space if you can notice the bubbles inside the epidural space, which relate to the presence of the fat into the epidural space. At this point, we inject our medication and the procedure is over. Soon I will post a video to explain the basics, how to perform it, and I hope my video is helpful.